realise outbreaks of this nature are very, very complex. It's difficult to predict how long the outbreaks will last, and it's not unusual for the outbreaks to last weeks, if not months, before coming to a resolution. They are extremely complex situations, and there are many facets to managing them and looking after the patients. Hospitals in other parts of the provinces are also experiencing C. difficile and C. difficile outbreak. We are not alone. So we have and continue to call upon the experts and around the province. You've heard Sue mention the provincial team that came in, and we also speak to our colleagues who've gone through this and who are going through this, so that we as a collective can affect the best practices, and we are doing all our due diligence. Last week, Dr. Christina Lee, who is the infection control physician who came from St. Joseph's Hospital in Hamilton, met with us and a group, and Hamilton has provided a lot of resource. Sue, for example, has spoken to Dr. Kevin Smith, who is her oppo, as it were, in Hamilton. And so we've had a huge amount of help from everybody, and we're incredibly grateful for the expertise that has given us. So I wanted to provide you with clarification on what hospital-acquired definition means. You've had it told publicly, but it's a patient who develops symptoms 72 plus hours after coming into the hospital. So when a patient comes into the hospital, usually through the emergency room, they are asked questions like, have you had diarrhea? When were you last in hospital? And associated questions. And where applicable, a stool sample is taken at that time, and swabs are done for other things such as MRSA and VRE. And of course, as you can imagine, this is an ongoing monitoring process that happens within the hospital. So there is variability from day to day of the data that you will hear and you have heard, and on an ongoing basis will hear, because patients get admitted, discharged, patients who are suspected that they may have C. difficile, their results come in and it may be confirmed that they have, or it may be denied that they have. And the patients who are inpatients who've been here for a longer time, they can develop C. difficile for other reasons. And the other reasons, of course, being a change in their illness status, such as they may need to have antibiotics, and those patients then, as you know, antibiotics, and Sue has mentioned the antibiotic stewardship program. Antibiotics can render patients, especially patients with multiple illnesses, prone to C. difficile. So the antibiotic stewardship program, and I have one dedicated physician who is doing that in association with his regular practice, with help from St. Joseph's in Hamilton, has been instituted, and these patients who are in hospital will of course be monitored, and we'll be using appropriate antibiotics for their illnesses. However, hand washing is the biggest and best way of controlling the outbreaks, preventing the outbreaks, and we have had lots of good information on hand washing, and the hand washing audits to date have shown 100% compliance. The doctors were 100%, the staff were 100%, anybody who was audited was 100%. So a small amount about the deaths and the feedback from the regional coroner. Again, I want to say exactly what Sue said. As a physician, I feel for those patients who've been afflicted with C. difficile, and especially for the families who have lost loved ones during this outbreak. We care deeply for our patients and recognise this is a dreadfully awful time for them. So the patients, to reiterate, the patients who have died had serious underlying health issues and had tested positive for C. difficile. So we are prepared, and people must be prepared, for more deaths to occur amongst our hospital inpatient population, as of course they are seriously ill with multiple health issues, which may be the thing that causes the problem for them. So again, all of the deaths have been reviewed and will be ongoing, will be reviewed by the coroner, and I also have instituted reviews to determine what role C. difficile played or didn't play in the patient's deaths. So late yesterday I spoke to Dr. Jack Stamborough, who is our regional coroner, and he acknowledged that we of course involved the coroner's office very early in the process to help with the outbreaks. They have dealt with many outbreaks across the province and have expertise in helping us with these. He also reviewed, he knew that the deaths that had been reviewed by his investigating coroners, and to date there have not been any significant concerns or recommendations identified from the coroner's perspective. Next week, early next week, Dr. Stamborough, along with senior officials from the coroner's office and the regional public health department, will be meeting with us as part of the management of this outbreak and our ongoing vigilance in managing it. So I have reviewed 14 deaths which occurred prior to this week. We have contacted families, and I will be speaking to them in the next 2 days. And once this process is finished, I will be in a position to share with the general public and the media and anybody else, including the regional coroner's office and the public health department, the results of my reviews. I go back to Sue to address further issues.